The first thing that comes to mind is bringing my expertise to the kids and the people of Malawi. There may be some, basic public health education that I can really teach the children and the adults in the country, and also teach a little bit about dentistry to my classmates, my peers. For each and every one of us has our own, expertise, and we're all coming from very different backgrounds, but I still think that there's some overlap where each and every one of us is trying to, improve our society and the world in our own ways. And I'm very passionate about dentistry, and I hope to maybe rub that off onto my peers. So I've done a decent amount of community service with alternate spring break in undergrad. But it was primarily domestic areas, rural South Carolina, Indian reservations in South Dakota. So I hope to branch out and really gauge what it's like to be in a rural developing country abroad, and hopefully use my experience domestically to improve the lives of those in Malawi.
Prior to attending law school, I worked as a legal client advocate for Hyacinth AIDS Foundation in New Jersey. So I'm excited that I can pull some of those experiences to the table and just advocate for people who are HIV positive and underrepresented and don't have equal access to justice. So whether it's equal access to medications or, they've suffered some injustice because of their status, stigma, all those things, I'm really interested to see how it plays out in Malawi.
I get that global health perspective, not just within the U.S., but we learned about the global perspective. I've also been a practicing nurse for the past 8 years. So I would say I'm bringing in a lot of interprofessional development skills that I've actually been practicing in the past 8 years. My end goal is to do global health in a global perspective. I'm also at the university I'm getting the global health certificate. Eventually I would see myself practicing medicine, nurse abroad, helping to develop and implement programs. My master's is in community and public health. So I would love to work with the vulnerable communities around the world.
I would say that the research experience I've had as an undergraduate and as a medical student has just taught me how to think critically and really evaluate the work that we're doing and its impact. I've always been interested in global health. I've been on brief trips abroad doing public health work, but this is the first time that I'm going on a long-term trip, and personally I really hope to gain some knowledge about whether this is something I can do for a much longer period of time in the future as a physician. I'm really excited to work on these sustainable developments, and it's something that I'm interested in doing as a doctor, so I think I will gain a lot of first-hand experience and exposure.
So before I came to the University of Maryland, I was a statistics major, so I did a lot of things with public health and biostatistics and epidemiology. So I had some exposure to this kind of research before. The pharmacy just gives me not only that additional background, but also learning how drugs work in the body, which I didn't have before. What I hope to get from this is the exposure, the experience of working with other professionals in a global setting, and then also the different types of patients, like the kind of patients that they have in Africa are just not the patients we have here. The issues that they think about and they think are important are not what we think are important. So just getting an appreciation for that is what I hope to gain.
Our perspective as social workers, we take a very broad perspective on looking at individuals, and we look at their family unit and their community and the society, and so we're trained to look at all these different layers, and I think that's a real asset to a project like this. And I'm just so excited and open to opportunities and learning and meeting new people and having new experiences. I've never been to Africa before, so I'm just super excited for whatever may come ahead.